one place right now. And I just want to say hats off to you for coming to this town hall and learning a little bit about NAMI and what's going on in our great state. Remember that NAMI New Hampshire provides support, education, and advocacy for folks that are dealing with mental illness and those affected by suicide. And with that said, I would like to introduce our executive director, Susan Stearns, and she will get this town hall started. So thank you very much for coming.
You're muted, Susan.
All right, it's only 3 years of practicing Zoom and I still haven't figured it out, but there you go. Hi, folks. It's really nice to see so many of you here tonight. Really appreciate you taking the time to spend the hour with us and learn a little bit about what we've got coming up in 2023 here at NAMI New Hampshire. It's been a really, it's been a busy year for sure. And we, in 2022, celebrated our 40th anniversary, which was really exciting. And I know we saw a number of you come out to do that and mark that occasion, and we really appreciate it. I am going to share a PowerPoint just sort of guide the conversation tonight. We will save time for questions and at the end. This is a Zoom meeting, so you can unmute and be heard. That said, we have over 90 folks who registered. Probably some folks won't make it, but we may have a few challenges if we get into a really robust conversation, but we will do our best, and I'm sure we'll have a good conversation tonight. So let me find my PowerPoint. From the beginning would be good. Todd did a really nice job in talking about what it is that NAMI New Hampshire does, our mission. So thank you, Todd. In terms of sort of laying out the groundwork as we talk about our work, and especially in the upcoming legislative session, we try and make sure all of our work here is guided by our strategic plan. And that strategic plan was developed with our board, our volunteers. We have over 200 committed volunteers across the state who help deliver a lot of our education and support programming, which we would not be able to have the reach that we do without them. So the strategic plan was developed with the board, our volunteers, our staff, and a number of our key partners around the state. It was also developed at the time the work began in early 2021. So we were in that period of time when we were all sort of holed up and expecting vaccinations were coming and life would go back to normal. So when we came into COVID, we knew that we had 1 in 5 adults, about 1 in 6 kids affected by mental illness in any given year. COVID has had a profound impact, as we all know, on everyone's mental health. And now numbers look more like 4 in 10 adults reporting symptoms of depression and anxiety. And then data indicates where we were. This is a household survey done in 2019. Then you can see in January of 2021, that window where we were developing the strategic plan, the numbers of folks reporting symptoms of anxiety and depression went up to 41%. Again, these are adults who are responding to this survey. And then in November of 2022, so not that long ago, we were still seeing those elevated reports of symptoms with adults around anxiety and depressive disorder at over 35%. So we know the impact of COVID, certainly. I think it's important to note that it's been really, really profound for youth and young adults, really, frankly, going up into the mid-30s that we see these numbers where we see the increased impact. We do know that a recent survey this fall, adults surveyed, about half of them, a little over half, reported they or a family member had a serious mental health incident in the year prior. And then actually this goes just over a year ago now. We know the kids have had significant impact. I want to really couch this though. We had a children's mental health crisis before COVID. It's been exacerbated by COVID, there's no question. And we've certainly seen this with the American Psychological Association, American Academy of Pediatrics, and the US Surgeon General having all declared that our youth are facing a mental health emergency. So the NAMI New Hampshire strategic plan has really 4 overarching goals in it. When our consultant did the surveying to lay the foundation for our strategic plan, what we heard from folks was great work that NAMI New Hampshire is doing. We need you to do more of everything, was really how that went. So first and foremost, and this has been consistent through our last 3 strategic plans, is this concept of NAMI New Hampshire holding systems accountable through our policy and advocacy work. So that's our first strategic plan goal, and has been for the last several plans, is that continued work and expanding on that work wherever possible. And then continuing with our core NAMI New Hampshire education support programs, making sure they're up to date, making sure we're utilizing, technology to make them more accessible. That's been a silver lining of COVID. The reality is the virtual world has allowed for a broader reach for a lot of our programs, and people who couldn't necessarily attend, say, a family-to-family class or a support group have been able to access it because of the fact they're virtual. That said, we know there are some folks that virtual doesn't work as well for, or for example, if you're a loved one who has a serious mental illness is living with you, it can be a challenge to do a support group from your home on Zoom. So we are grateful that we have the option, but we're also very grateful that we're reaching the point where we're able to do some things in person again and try and expand that reach. And then again, this was in 2021 that this strategic plan was being developed. And like a lot of organizations, we had to take a good hard look at ourselves in terms of, we are an organization founded 40 years ago with the idea of people living with mental illness, with serious mental illness, should have full lives in their community, but fully integrated living in their community. Yet when we kind of looked around at ourselves and our support groups, for example, our staff, our volunteer pool, we were really struck by how much we all looked alike. So one of our foundational goals and a real effort that we have been undertaken is to really incorporate diversity, equity, and inclusion principles throughout our structure, our governance, our programming, and really make sure that we are indeed being inclusive, and that everyone who is impacted by mental illness and suicide can access services through NAMI New Hampshire. And then finally, just really key, obviously, is supporting our operational capacity, because the reality is that without that foundation, we can't continue to do all the great work that we've been doing that people said, please continue to do and do more. So that is one of the 4 foundational goals of our strategic plan. So in terms of our DEI work, we have a committee that meets monthly, made up of staff, board, and volunteers. That committee has been working diligently for over a year now, has developed their working ethos, a charter, goals for the organization that the board will be approving very shortly. We came to this work doing some assessment of where we were, and through the work that we were doing with families. And today, we are supporting families, particularly in our children's program, who speak a variety of languages, including Swahili, Spanish, Arabic, Mandarin, Nepalese, and we have folks who are using American Sign Language. So, we do have interpretation services that we use, but it was a good opportunity for us to take a look and see, we really do have a diverse population here in New Hampshire. We're already serving them, and we need to make sure that we do a better job and make this front and center. We did have a number of opportunities to expand our partnerships in 2022. In particular, we expanded our partnerships with a number of our LGBTQIA+ colleagues, and made sure that we were participating in Pride events throughout the year, and also facilitated a virtual community conversation around LGBTQIA+ allyship. We partnered with SAMHSA, the Substance Abuse Mental Health Services Administration, and their New England Mental Health Technology Transfer Center during Minority Mental Health Awareness Month in July of this year. And we partnered with the MHTTC, as that's called, along with NAMI Connecticut, to work on what is called a Diversity Inclusion Project Showcase, fondly called DIPS, and bringing that to New England. We were thrilled to have the opportunity to highlight and spotlight some of our partners here in New Hampshire who are doing really important work, especially some of these emerging nonprofits working with new Americans. As we look forward for the coming year, we look to expanding these partnerships. We have plans underway for organizational-wide training that will be staff, board, volunteers. We have updated our website recently and tried to make that more accessible with translation built into it. We have also updated some of our HR systems and protocols, and we'll be working on updating handbooks, policies, and procedures in the coming year. And then stay tuned. We have a new resource page soon to be launched that we focused on resources for individuals and families who are justice involved and have mental health challenges, including, for the children of those who are incarcerated. So as we look forward towards this legislative session that has just started here for 2023, full disclosure, those are pictures of me with our federal members of a couple members of our federal delegation. I was lucky enough to participate in the Capitol in a Hill Day, a Capitol Hill back in November 30th. And so technically, though, we're talking here about our New Hampshire legislative session. Big priority for us in this session is reauthorization of Medicaid expansion. We know that is going to be critical work before us. We have obviously continuing our work around emergency department boarding. There are a number of issues here. I'm going to move on to the slides particular to them. So Medicaid expansion. I can't read my slides. There we go. Medicaid expansion has been critical, and frankly, I can tell you it's been critical for my loved one who is a recipient of Medicaid expansion, living with a mental illness. So I can speak personally to this, that it really has played a critical role in making mental health care and substance use disorder treatment more accessible for more Granite Staters. Indeed, we know in fiscal year 2021, so this is the fiscal year that ended on June 30th, 2021, that at that point, over 11,000 individuals had accessed outpatient mental health services. These are individuals who were able to access it through Medicaid expansion. Another over 26,000 had obtained mental health related medications. 830 had inpatient psychiatric hospitalization. We had over 7,000 folks who used Medicaid expansion to access critical substance use disorder outpatient services. Another 7,500 access medication assisted treatment, and nearly 2,300 used the program for inpatient or residential SUD treatment. All right, there we go. And ED department boarding continues to be an issue for us here in New Hampshire. And then I want to say that this January marks 10 years since Ken Norton, my predecessor, had called a press conference on the issue in the lobby of the LOB, the Legislative Office Building. So this has been a decade. In December, we had a daily average wait of number of 24 adults and 14 children boarding at emergency departments waiting for an inpatient psychiatric bed. We know that this most visible symptom of the crisis that our system is in really comes from a number of factors. And it also is, I want to stress, the most visible symptom of our stressed mental health system. These issues include workforce, access to housing, and things like reimbursement rates for providers to help and make sure we have sufficient workforce. I think we all hear about workforce issues throughout various sectors, but clearly in healthcare and mental health care, it is an enormous challenge. We know that folks with mental illness, if they can receive the right treatment at the right time, at the right place, they will do better and have better outcomes, avoid things like becoming homeless, needing to be hospitalized, and avoid things like incarceration or becoming involved with the criminal justice system. We know that here in New Hampshire, our peer workforce is really critical to helping us address this. Yet we know that we haven't always done a great job at really at expanding that and really utilizing our peers. The state has a peer workforce advancement plan that I know there's currently an RFP out looking for someone to help with implementation of that plan, which will definitely help with expanding our capacity in terms of workforce. And frankly, all the data shows that peer support leads to better outcomes. So this is a win-win for us when we work towards expanding the utilization of our peer workforce. We know that the workforce issue is proving to be one of the bigger challenges that we're facing. And we know that we have a lot of folks in the state, particularly our friends at the Endowment for Health. They have led a project that will hopefully, in terms of all of the healthcare workforce, help us with moving forward and addressing the shortages that we have so that people can get the care they need. So, and again, I think we're all very conscious of the housing costs here in our state and the difficulty with accessing affordable housing for anyone. There's no question that housing is a significant issue for people living with mental illness. Not being able to access affordable housing can lead them to not being able to, for example, be discharged in a timely fashion from New Hampshire Hospital or other inpatient facilities, which then can make it difficult for folks to come in on the front door, we know, and exacerbates the emergency department boarding crisis. We also know that housing issues are impacting our ability to recruit workforce. So the reality is that there are times that we hear from our mental health provider partners about how they make offers to folks who want to come to New Hampshire. And one of the biggest challenges the provider finds is trying to find a place to live. So we need to increase housing stock and the accessibility of that housing stock. There's no question. We've seen a lot in the media recently. I know I have, around the encampments of folks who are unhoused, and some cities and efforts to try and deal with that don't always seem like sometimes those methods seem counterintuitive to or don't seem to get at the root of the problem, which are, the folks need a place to go. And in terms of the workforce, another real key factor is New Hampshire's Medicaid reimbursement rates continue to be amongst the lowest in the country. Even though there have been in recent years a couple of small increases, they were too small, and now far enough back in the past that we need to address this so that our providers can pay a competitive wage in order to and be able to recruit and retain the staff that we so critically need here in New Hampshire. The reality is that those reimbursement rates will have an impact, not just for community mental health centers. We hear from private providers too, who really struggle with being able to serve folks who are on Medicaid because the reimbursement rates are so low, and so that it's just not a viable business model for them. And then here in New Hampshire, our youth suicide rate continues to be a significant issue and outpacing the nation. Suicide is the second leading cause of death for Granite Staters aged 10 to 34, and the fourth leading cause of death, actually, that's wrong, third leading cause of death for those ages 35 to 54, I believe. And we know that there is a lot that needs to be done in terms of preventing suicide in our state. We need to have these investments in our system in order to do so. We need everyone to participate. Preventing suicide is everyone's job. The reality is that everyone who intersects with kiddos particularly needs to be aware and trained, but we all have a role to play. So we're going to be talking more tonight about mobile crisis, rapid response here in New Hampshire, and mental health crisis response, which are really critical in order to address this issue. Oh, that's the next slide. Sorry, I should have practiced more. So again, really, as challenging as things may seem, some really good things have happened. The state has been moving forward diligently with implementing the 10-year mental health plan. Indeed, last January of 2022, the state launched the New Hampshire Rapid Response Crisis System, which is truly a transformational moment for our mental health system here in New Hampshire. You know, since January 1st of 2022, the New Hampshire Rapid Response has had over 25,000 contacts. And then in July of 2022, you may recall the nationwide 3-digit 988 number went live. And so the New Hampshire Rapid Response System started responding to those calls and texts that were coming through another 988 Suicide and Crisis Lifeline. Right now, those services have been largely funded here through federal dollars that have come in related to pandemic dollars that have come in. Those dollars, we're secure right now in funding that rapid response, as well as the mobile crisis that went with this. I mentioned that it's January 1st of 2022, so the rollout of statewide mobile crisis, again, truly a transformational moment in New Hampshire. But the reality is that we're going to need to all work to ensure that our legislators and policymakers implement, when the time comes, the measures to ensure that we have funding to sustain New Hampshire's rapid response. The reality is that it is a critical lifeline, and we know that we have to sustain it. So we'll be looking to all of you when the time comes to help support us as we advocate for that. And it's important to realize that, the advent of New Hampshire's rapid response in 988 offer the opportunities for folks who in the past would have probably called 911. So it offers the opportunity when you call rapid response to have a mental health response to a mental health crisis. And they can do that assessment for you on the phone, determine if a mobile crisis response deployment would be appropriate for you. Perhaps what you need or your loved one needs is a crisis stabilization appointment in the next day or two. So those are opportunities that we didn't have before the New Hampshire Rapid Response System went live on January 1st of 2022. And I would say that this is something, the fact that New Hampshire was able to do this, if you think about it, lead up to and launching such a huge initiative during a pandemic, really speaks to the fact that we can do hard things. I think of the rapid response and including statewide mobile crisis and the implementation as being proof of the fact that we can indeed create truly meaningful systems change. And as we look towards this coming year as well, and not just this year, we're very conscious of the fact that a lot of far too many folks who are involved with the criminal justice system are people with a history of mental illness. And indeed, here in New Hampshire, we know that about 2 out of 5 adults in our jails and prisons have a history of mental illness. And we hear from our county superintendents about a lot of folks being held in protective custody for non-criminal detainments. Again, this speaks back to the, folks are getting involved in the criminal justice system when maybe what they need is to be involved in a treatment system. And we know there are a lot of efforts underway. Our friends at the Administrative Office of the Courts, or the New Hampshire court system, is underway, has a project underway to try and ensure that people, to find those places where people become entangled in the criminal justice system and see how we can make sure that they get to the right place or avoid becoming involved at all. So there are a lot of folks who are, investing a lot of time and effort. We have consultants coming in from outside of New Hampshire, national consultants who are assisting. And I serve on a couple of commissions that look at these issues. We know that we have a lot of work here to do, but we know that far too many of our folks get involved in the criminal justice system, and those outcomes are not good for them. And what they really need is to be involved more in the mental health system. So as we head into this upcoming legislative session, I do want to show you this. This is from our website. And if you want to know what we have going on, what look at what the latest public policy alert is out from NAMI New Hampshire. They come out about every Friday. And then information in terms of how to sign in on a bill. And also you can see testimony that we've already given on bills on this page. So you go to our website, you go to the Get Involved tab, and from there it will give you this Take Action. And when you go there, you'll have these various options, but you'll also see here in the middle, which my pointer's gone, there it is. You can sign up for public policy alerts. So if you click on that, then you can put in your email address, sign up, you'll get those public policy alerts from us. And you may be receiving our twice a month e-news. That is a different list. So you do want to sign up for public policy alerts if you haven't already. I also want to give you all a little tip that when you get those emails from us, whether it be e-news or public policy alerts, and say you like, oh, I'm tired of, I don't have time for this, just delete it. Because if you click the unsubscribe button in it, we can't add you back. So it's sometimes people do that and they don't mean to be, because it sends a message to our system of don't ever contact this person again. So if what it is you just want to, or if you just want to not get that particular piece, we can that particular email, we can take you off that list. But I just give you that one caution, because we have had some folks who come back and say, why don't I ever hear from you? And it's like, well, you clicked unsubscribe one time and we can't email you anymore. And so this is just a quick snapshot of a public policy alert that went out on Friday. And what you'll see when you get these is, and this has been laid out on the slide, so obviously it looks a little different when it lands in your email and you see it on your phone, but it gives you a chance, it tells you what's coming up that we've seen is coming in the next week, that are bills that NAMI New Hampshire is tracking, that we're taking a position on, whether it be supporting or opposing, and it will give you where you can sign in to support or oppose, or how you can contact the committee members yourself. And of course, always encourage folks, if you'd like to come out and testify in person, that's always great. Unfortunately, it's only in person, the ability to testify, it's not virtual. So some folks that doesn't work for, but you can still submit testimony and you can still always sign in and support or opposing a bill without submitting testimony. And you can contact your legislators or committee members anytime. They're very accessible. So few dates that I just want to make sure folks have on the radar for 2023. And that would be, our annual conference on May 10th. It will be virtual again this year. So please keep that date in mind. And then our annual meeting will be on June 15th in the evening. And that will be at the NAMI New Hampshire office. So look forward to hosting you all here. And then on October 1st, we will have our 21st annual NAMI Walks New Hampshire. So that will be in person, but virtual is always an option. But we look forward to seeing all of you who are able to come out and join us on the field. We have had a phenomenal response to folks. This year was our first year back since 2019 in person, but the 2 years we did virtually, we couldn't have asked for more. And this year, everyone, you've all come through time and time again, and we can't be more grateful. And one of the things I will tell you is the fundraising through the walk, which the walk is more importantly New Hampshire's largest mental health and suicide prevention awareness raising event. It is also our largest fundraiser. It is free to participate. You don't need to fundraise. And I know that our director of development is on here and she's probably going to give me a few words. But for those of you who do fundraise and donate to it, the walk provides critical unrestricted dollars that help support a lot of our advocacy work. So it's really a win-win all around from an advocacy standpoint. I would be remiss if I did not make sure that I included in any presentation information on where to access crisis resources. I referenced New Hampshire's rapid response and the rollout of 988. Some of you may be thinking, why are you sharing the rapid response number when we can just call 988? So there's a little caveat on 988 here in New Hampshire, and that is that it does not, 988, the federal government has not yet established geolocation. So the call gets answered based on the area code you're calling from. So if you don't have a 603 area code and you call 988, but you're in New Hampshire, your call will get answered in another state, the state that your area code originates out of, which is fine. 988 call centers, they're all great. The only thing is here, only the New Hampshire Rapid Response Access Point, the New Hampshire call center, can deploy a New Hampshire mobile crisis team to you, for example, or make that next day crisis stabilization appointment. So we do encourage people to keep the 833-710-6477 number handy, because it is, for folks who don't have that 603 area code, really a really important number to call. And of course, the website is nh988.com. In addition to that, now you can call, text, chat with 988 or New Hampshire Rapid Response, but the crisis text line is still a viable option for folks. Some folks really like the crisis text line. And then I also want to call out our friends at the Trevor Project, who do phenomenal work supporting LGBTQIA+ youth and preventing suicide in that high-risk population. They're available 24/7, great resource, especially for our young folks. So always want to include Trevor Project as an option for folks. These are just a couple of quick screenshots. We have a variety of resources available. Happy to make those to you. These are two different rack cards. You're seeing the two sides next to each other. One is for families of kiddos who are boarding in emergency departments. The other are resources for adults who are boarding in emergency departments. We try and make sure these get out regularly to all the emergency departments in the state at all 26 critical access hospitals. But we're happy to share them with anyone else who might want them. And certainly if you work at a hospital and you're thinking, I haven't seen those lately, let us know and we will get them out to you. And then we also have a rack card. Again, you're seeing both sides here, that a really quick snapshot of some of the free services NAMI New Hampshire offers. See this as an opportunity. We recognize folks are having to wait to access essential mental health care. We don't offer that level of care, but we do have a number of things like support groups, education programs that can help someone while they're waiting until their appointment. So we encourage folks to certainly reach out to us. And of course, our information and resource line can be really helpful. It's not a crisis line, but in helping folks navigate the system, find resources. So always encourage folks to reach out to us. Again, it's not a crisis line. It's not 24/7. It's just weekdays. You leave a message, someone calls you back, usually the same day. And we'll work with you when figuring out, how to access resources for yourself, for your loved one. And we have a couple of materials here that promoting our LGBTQIA website, web page, as well as the one we have for our BIPOC AAPI members of the community. And these are cards that we're happy to provide. A lot of folks do like to have them at various various events and such. So always happy to provide you with that. And we have more than this, of course. So before we open things up for questions, I do want to just say to you all that please take good care of yourselves. We know that the reality is we can't take care of others and help move this kind of truly systems transformation forward unless we're taking care of ourselves. So this is just a little reminder. Make sure you're getting a little fresh air every day. Sleep is really important. I always remind the younger people in my family that sleep deprivation is used as torture. So make sure you get enough sleep. That the whole thing about exercising, stretching, drinking enough water, please stay hydrated, folks. And then be kind to yourself. I think we can be really hard on ourselves in this field. And the reality is that we are all coming at this, having gone through some real challenging times. And we all know that we all have things going on in our lives that are challenging. So always be kind to yourself. And then finally, and this is, you can all remind me of this, practice saying no. One of the most startling articles I read a couple of years ago was talking about how if you want to know how busy you'll be next week, look at how busy you are this week. And so it's an ongoing reminder to me. I've got my staff all laughing at me behind my back right now, but truly try to set some boundaries and take care. And then finally, and we'll make all of this available, our information and resource line number, but also our websites and our social media. We have a pretty robust presence on social media, and I encourage you to check us out and join us there. Oh. All right. Actually, I am 4 minutes ahead of schedule. I think we're ready to take questions, Todd and Holly.
Sounds
Do
great.
you have any? Do we have any questions in the? Maybe not.
No chat questions yet. We did have a few questions that came in through folks' registration process. So the first question is, anything being done to increase funding for more available rooms in hospitals? Because of a lack of funds, are rooms closed?
So thanks so much for bringing that forward. Folks may have seen that there have been some efforts, and I know we may have some folks from the New Hampshire Department of Health and Human Services here, that there is talk about an additional facility in the greater Manchester, greater Nashua area, and the state making an investment there that would be part of Solution Health. That is still, as I understand it, being discussed. We also know that the state is on track to build a forensic hospital on the campus of New Hampshire Hospital, which would house those folks, provide that level of care for people who are involved in justice involved. So that would help relieve some of the pressure on our existing systems. I think the reality is that we know that we need more community-based care. The designated receiving facility that is furthest north is in Franklin, New Hampshire, which is frankly not very far north. It may feel that way if you're in Nashua, but it's not when you look at the whole state. So we know that there's a real need. We are heartened by, of course, the state's purchase of Hampstead Hospital, and will be standing up the I'm going to partial the PRTF, partial residential treatment facility there for youth or young. Yes.
Yes, it's the residential treatment facility.
Thank you. Thank you. I could see the acronym from our meeting earlier today, and then I was like, what does it stand for? Thank you. So, and that will expand some capacity, but the reality is that we know we do not have, I'm not going to sugar, we don't have like, oh, we have something on the horizon tomorrow. All of these are things that will not be here in the imminent future. And we're going to have to wait, as in some cases they are frankly literally being built.
All right, the next question from the chat: are there plans to increase mental health crisis training for law enforcement agencies throughout the state?
Thanks so much for that question. Crisis Intervention Team Training, or CIT, is something that's near and dear to all our hearts. And we have been very fortunate. We do have a SAMHSA grant that provides funding for 3 CIT classes a year, which typically have about 25 folks we figure we can train at a time. However, we do have a contract through Police Standards and Training Council this year that adds another 7 CIT trainings, bringing that to a total of 10 for this current fiscal year. So that's FY23, and that will end June 30th. We know that the legislature has indeed invested in CIT. Last year, Senate Bill 376 included funds that went to the Police Standards and Training Council that can be used for law enforcement agencies, so departments that have not yet had anyone trained in CIT. So this would be particularly helpful to the smaller departments in the state that can be used to help cover the costs. So while the training itself doesn't cost a department to send someone, it is a 40-hour training, and this is considered the gold standard for training law enforcement and other first responders to respond to people in experiencing mental health crisis. 40 hours is a huge commitment, obviously, to send a staff person. But beyond that, if you're sending someone who is a first responder, you have to backfill their role for the 40 hours. So it's can be a pretty significant cost for a small department. So the SB 376 that passed last year did create this fund that will allow police standards and training to reimburse smaller departments that don't have anyone who's CIT trained for their costs to send someone. So we look forward to continuing the CIT work. I do want to give a shout out to our friends at the North Country Health Consortium, who they have a grant that they were able to include an additional CIT training in. So we'll be doing one up in the North Country. So that actually brings us to 11 for this year. So, you know, thanks to the partners we have expanded that. There's no question that we need to continue that work. We certainly hope that we will be continuing at the same pace that we have been, or maybe more CIT trainings in the coming year. We don't have contracts for the next fiscal year at this point, so I can't tell you exactly, but we do know that our partners are very committed, and clearly recent events, I think, have highlighted for everyone the need for this to continue and to grow. There are conversations about, you know, really how do we expand this so that every new officer in New Hampshire too will have this training. So those conversations are underway. I welcome folks who want to outreach to have further conversation or have suggestions or ideas. These are really important issues.
We have a couple of related follow-up questions in terms of CIT, Susan. One is the New Hampshire CIT program evidence-based? And if the classes are less than a week, could we train more officers?
So that's actually a great question tied together, because it is considered a best practice. There's varying literature about whether it's evidence-based, and see, someone's adding a comment for me. And the reality is, if you don't do the 40 hours, you're not maintaining the fidelity to the model. So I do want to mention, and thank you, Elaine DeMello, who put it in the chat, NAMI New Hampshire has for well over a decade, it's more over 15 years at least, been providing 2 days, 16 hours of training as part of every academy training. So this is for new recruits. So that shorter training does exist. But the reality is that in order to have someone be CIT trained, they need to do the full 40 hours of CIT.
All right, we have a message from Dennis just saying thank you. It's great to work with NAMI New Hampshire and the wonderful staff. So thank you, Dennis. Question, there appears to be no place for those with developmental disabilities to be admitted. Recently had an issue, went to the ED and were sent home, even though the young adult still had suicidal ideation with hallucinations. They were told there's no facility in New Hampshire for this population to be admitted to.
Unless someone else on this call can tell me otherwise, unfortunately, I believe that to be true. I'm looking at Holly.
I think, you know, depending on how young the adult is, Susan and I were in a call today with the folks at Hampstead Hospital, and they do take individuals up to the age of 25. And if I'm not mistaken, they did mention that they do still take individuals with developmental disabilities. That being said, if you're talking about somebody over the age of 25, then Terry, that's disappointing, and I will clarify with the folks at Hampstead, because it was my understanding from the call today that they are taking individuals with developmental disabilities. So I will double check on that to make sure that I heard what they were saying and get back to you on that.
I think all of us who were there, I'm assuming Michelle, we thought we heard that as well. So Terry, that sounds like we should definitely follow up and see what happened there.
Holly, if I can tag on to that too, it's my understanding that they're an at-will admission. So if an individual has guardianship over them, that immediately makes them not eligible for admission. So if we can clarify that too, please.
All right, we'll follow up on that. And Terry, we know where to find you.
Thank you for that. Are there any plans or considerations for adding mental health awareness training, like the NAMI Family to Family course, to high school curriculums?
Oh, that's that. So we do have plans underway to stand up what is called Ending the Silence, which is really more of a speakers program for middle and high schoolers. In terms of, so those of you who may not be familiar with Family to Family, it is sort of one of the foundational signature programs for NAMIs all across the country. It is an 8-class program that is for family members who have, or those who have an adult loved one in their lives with a mental illness, and it is truly life-changing for so many families in terms of helping them understand and work with their loved one in terms of their recovery process, and just helping to, you know, improve those family relationships. So that's a really interesting question. I don't know that I've heard it before about bringing family to family to the schools. We've had conversations about bringing family to family to incarcerated populations or the families of incarcerated populations. So, you know, don't have plans afoot for that, but we do have. And actually, we in the chat, we have a link to learning more about Ending the Silence. We also have, through our Connect program, we have what is the Connect Youth Leader program, and it's also a Connect Young Adult Leader through our Connect Suicide Prevention program. And we do work with schools that want to bring Connect into the school. And I will tell you, when I've had, and I've not had a lot of opportunities in my role, but when I seize them, when I have them, the opportunity to meet any of our youth or young adult leaders, because my goodness, the work that they're doing it's phenomenal. Not only are they saving lives, but they give me such hope for the future. I keep saying, when every time I come back from meeting with, you know, when I've met one or a group of our youth or young adult leaders, I think, gosh, if we can just manage to keep things from going to pot in the next 10 years, I have every confidence in them. So that they'll take care of things.
And Susan, I just wanted to bring up that this isn't family to family specific, but there was a youngster in Merrimack, high school student, who approached his representative about getting a more robust mental health training within the health class in all the high schools throughout the state. And that is a bill that will be heard this session. And the bill is actually very detailed about everything that would need to be included. So again, it's not, you know, necessarily anything that's based on any of the trainings that NAMI does, but it would be a lot more of a robust mental health training within the health class if it gets passed.
Thank you for that reminder, Holly. I had forgotten about that piece of legislation, and that, you know, again, our young people give me such hope, but we will be supporting that legislation going forward. And if you sign up for public policy alerts, you'll know when you can sign in and support it too.
Absolutely will. There was another question that came in via the registration forms. The public health education and detailing program is beginning work on a mental health action kit from New Hampshire providers to help them give better resources to their patients. Is there a good central place to send them for resources available around the state for patient resources?
I guess I'm not sure I understand the difference between patient resources and resources for the unless we're talking maybe an individual living with a mental health condition themselves. I mean, I tend to look at certainly for New Hampshire-based resources. NAMI New Hampshire works really hard to keep our resources up to date. If you're looking more nationwide, of course, there's NAMI National at NAMI.org. I would encourage folks to check out the New Hampshire Community Behavioral Health Association's website, of course. And of course, the New Hampshire Department of Health and Human Services lists a number of resources, including the peer support agencies in the state. All of those should be also on our website. So I confess I tend to default first to NAMI New Hampshire's website if I'm looking for New Hampshire based mental health resources. I will open this up to we have several staff on here if you have additional suggestions. I see no one unmuting themselves.
I would suggest, you know, the first thing that comes to my mind is calling the information and resource line. And that's a good start. And the folks there can also help direct callers to other resources.
Yes. Anything else, Kim?
We had one other comment there in the registration, expressing concern and lack of funds around folks who are currently unhoused and potentially living with mental health conditions. So generally looking for thoughts and ideas there.
Yeah, this is something that is obviously it's front and center for a lot of folks recently, and actually we've had some internal conversation. You know, the reality is it's an investment in housing, and the state has to make an investment. There isn't a solution that doesn't involve making an investment, but for people with mental illness, you're talking about various types of housing, right? Or various types of beds. People often talk about beds, and we do that because we talk about the number of people boarding emergency departments, and you know, thinking about inpatient psychiatric beds. The reality is a lot of those folks who are boarding in emergency departments might not be boarding in an emergency department if they had access to something like, say, supported housing, right? We need more supported housing in New Hampshire, or if they'd had access to respite. We have very few respite beds in the state. Crisis stabilization beds. Again, that's not a resource that we very much need here in New Hampshire. More step up, step down programs and beds. So we don't have a robust array, especially compared to some other states. I mean, compared to some, we're doing well, but we really don't have a robust array of housing options, let alone sufficient. And I frankly don't see a solution to that doesn't involve significant investment. Again, I will defer to Holly or anyone else who feels like they have an answer.
I haven't seen any, just so folks know, I have not seen any specific legislation that would put funding towards housing as of yet. So we're going to be paying attention to the budget to make sure, or to really encourage lawmakers to make sure that there's money included in the budget for this specific purpose, because we need to do something. We need to do something now about housing.
All right. Any other questions, folks? I'm not used to a NAMI New Hampshire meeting where people aren't making a lot of noise. Oh, thank you, Michelle Wagner. She's put in the chat about we do have an Onward NH that webinar coming up. If folks can see that on the 25th, addressing homelessness and early serious mental illness. So please stay tuned. And those are free, and they are recorded, and they'll be available on the onwardnh.org website after the fact as well. Great. Well, I want to thank everyone. I know Todd probably has a few words he wants to say, but truly very grateful to you all for choosing to spend your evening here. And most of all, incredibly grateful for all that you're doing in order to help improve the lives of folks impacted by mental illness and suicide in our state. Truly, thank you. Todd?
Yeah, thank you very much, Susan. I appreciate the town hall and giving people an update. And I appreciate everyone on this call. I really do. It's fantastic to see everybody in one place virtually. I wish it was in person, but that's okay. I really want to encourage you to support NAMI New Hampshire financially. Our great work is done by dedicated staff and hundreds of dedicated volunteers. And on behalf of the board, I would really want to thank you again for coming to this and supporting NAMI New Hampshire. There will be a link sent to you if you registered to see this recording, so you can watch it again, or you can forward it to somebody else. Also, there will be not only links in the chat, but also links that will be sent to you if you've registered also. And once again, we're just very grateful for everyone that's partnered with us, and we'll see you at the next one, or maybe sooner. Thank you.
Take good care, folks.
Bye-bye.
Good night. Thank you.